So for the ACL, the tissue here tends to be very tough, and if it's been injured, tends to be very sensitive and inflamed, so it can be quite uncomfortable. Important to educate and prep your patient about that. Let's get this knee even a little bit more into flexion and support it on a pillow so she can relax it. And I'm going to use a very thick needle. A thin needle is going to bend, it's going to hurt more, and it's not going to get to where I want to go. So I'm going to use, this is a 24 gauge needle. It's 75 millimeters long. That's almost certainly going to be long enough to get into this area. And then I'm going to find the lower border of the patella again. I just moved her knee a little more into flexion, so I'm going to ignore the dots that I drew and just go with what my hands tell me. And I'll start at the medial aspect here. And I want to shave the needle very close to the lower border of the patella. If I start too far down, I'm not going to get the right angle to get to the anterior attachment of the ACL. So I'm just going to go just below the border, through the skin, aiming for that anterior attachment to the tibial spine, which is the little bony, rough bony ridge that we saw in between the condyles of the tibia on the skeleton a little while ago. Okay? So if I want, I can actually even put my finger here to serve as kind of a target, telling me that's the tibial spine along the midline there. And I'll advance the needle very slowly. And you just tell me yet if it's you go ahead and yelp if it's particularly uncomfortable or painful, and I can.
It's not that.
Not okay.
At all.
Okay. Good. Okay. So now I just felt the needle run into bone, ran into a unmistakably bony end feel, hard resistance, and now I'm going to start probing around a little bit.
Oh, there's
There.
a little heaviness.
A little heaviness.
Yeah,
Okay.
sounds-
Okay. Okay, so I'll just pause for a moment and take any questions that anyone has.